Okay. Okay. All right. So I've given you all chapter 1 packets. Dr. Smith has graciously gone over all the information there is in the chapter 1 packet. So we're going to go through the software system. Okay. All right. So what you want to do is daily, when you're going through the electronic medical records, as she said, the electronic medical records, and I think I said it before to my students, is part of the provider's office, meaning that that when the patient is seeing the physician in the provider's office, the physician is the main custodian of that chart. Okay. And if the patient is in the hospital and they have electronic medical records at their main providers, can everybody see this? No? Do I need to turn the lights off? Okay. All right. So could someone get the lights for me? Thank you, Dr. Sunshine. When you go into a hospital, and I think I said this to my students once before, everything is pulled through a portal system known as the RHIO, okay, the Registered Health Information Organization, which filters through to allow healthcare workers to access and retrieve your electronic health record on a broad scale, on a much broader scale, okay? They cannot retrieve your SOAP notes per se, but they can retrieve your patient demographic information. And what have I said, students, that's on a patient demographic information? It is listed. Gender, where they live, what else? Their job, what else? Their ethnicity, what else? Their age, what else? Their insurance company, that's real important. You know, the insurance company, their ID number and the group number and how to contact the insurance company, okay? So all that is limited to the RHIO portal, okay? In order for the healthcare worker in the hospital to take care of that patient. Now, they can also retrieve the patient's prescription from that provider's office. They can also retrieve any labs and or radiology from the physician's office. That's on an electronic health record standard. Anything else that's more that needs more information to be reviewed, they would have to fill out a release of information form. Remember, we talked about the release of information form, that when the patient signs the release of information, they're going to fax it over to that doctor's office or that other provider's office, and they're going to say that this patient gives us permission to get copies of their medical record from your office. And so from one provider's office to another provider's office, should it be free or should it be charged? Free. Should be free. Okay, very good, very good. It's all right. It should be free. Now, if the patient is requesting their medical records to be from the provider's office into their hand, should it be free or should they pay for it? They have to pay for it. And what have I told y'all once before? The first sheet is typically how much? $25 for sheet number 1. Sheet 1 through 10 is how much? typically about $1.50 a sheet. $1.50 a sheet, pages 1 through 10. Pages 11 on forth is about typically 20 to 50 cents per sheet. Okay, so they're gonna get you on the first sheet. They're gonna get you the first 10 pages, or they're gonna get you real good. Oh yeah. Okay, so very good, very, very good. Okay, now let's look at the medicine software. Dr. Betty, I'm gonna get in touch with Dr. Orday. I think she's out in Missouri City, and I'm gonna have them to do a career day event for our classes. And I'm gonna ask your class as well as mine to come dressed up for career day, okay? And they're gonna talk to them about their resumes, how to fill out for career services portal system, so that you keep close relational ties with the career services department, because they're the ones that help you find the jobs. Once you complete our program, you're not alone in finding a job. That is what career services is for, okay? Not only that, but they will also help you find access to clothing, which is called Dress for Success. And I've heard rave reviews about Dress for Success. It's very nice. Mia Gradney from Channel 11 is a big sponsor of that. So we're going to have that day, and then I'm going to also share a resume template with your class as well as with mine on how their resume should look, what all should be on it. Miss Harday and I think his name is Mr. Lewis that works for her. She's familiar with how I flow and how I do things, so I've given her that and the different job titles that they can do once they finish this program. I would say this, and I think Dr. Smith can attest to this. You know, don't be so narrow-minded looking for a job just doing building and coding. You can do more than just building and coding. Hospital scheduler, admissions clerk, get your foot in the door and network your way in. Okay? Once you get your foot in the door and you get that experience, give yourself 6 months to a year to sit in that position. And then once you finish with that, then you can kind of bounce around, okay? And I'm going to teach you about the bounce around and the salary uptake on that, how to do that, okay? So, because I've done it for a long time. All right, now let's get back to the software here. Let's look at this. Let's go up here to the main menu. Okay, so we have select. So let's click on select. Everybody need to click on select. Oh, I'm sorry. Did y'all open up your medicine software? Oh, I'm sorry. My bad. Okay, let me go back. Okay, so your medicine software should look like this software right up here where my mouse is. It should say medicine student. Right where my mouse is. If you can see me on the screen. Okay, y'all's is at the bottom. Okay. I'm sorry. Thinking y'all on the same thing. Let me know when y'all have opened it. Okay, put your name in there. Put your name. The student ID, put your name in there. Do you see it, Cindy? Okay. Okay, everybody got it? Okay, so let me go back to mine. Ooh, let there be light. Okay. All right, so let's go to select. We're gonna look and see what's available under these pegs. So you have patient, you have existing encounter, new encounter, pending orders, Print dialogue. Okay. Remember we talked about encounters the other day. Encounters consist of what? The procedure code listings, the diagnosis code listings, the short order form of the what? CMS 1500. Remember that? The physician is going to check off what's needed, and then you're going to know how to put this in. Well, the encounter form on here is going to be somewhat the same, the very exact same thing. Enter. Nomenclature. Word search. List selection. Form selection. Disease prompt. Intelligent prompt. Prompt with current findings. Nurse. Route medicine hierarchy. We're going to talk about the trees and the branches. Remember when I told y'all in the she got it, she understands trees and branches. Okay. Remember I told y'all that when you find your ICD-10 codes or your CPT codes, you go by what? The main what? Term. And then it branches off to what? And then it branches off to another what? Subterm. Of a subterm. And then it may branch off to another what? Subterm. Of a subterm. There you go. There's the tree. There's the tree. Okay, very good. All right, chief complaint. Allergy. Order. Prescribed prescription. History. Family history. Place symptoms in review of systems, the ROS. Okay, that's going to be really important. So why is Ms. Harper going through every detail of this menu bar? It's because some of you all may end up being scribes. There's a such job called medical scribes. Medical scribes, how many of y'all been to the physician office and your physician or your nurse walk in with a beautiful little laptop? They so cute, right? They just walk in with their cute little self with their laptop. Okay, so sorry, yeah. Okay, and the doctor is talking to the patient. You're gonna have some doctors, they're not gonna wanna sit up there and talk to you and matriculate through the software system. So that's where your job come in. You're gonna be the one listening to what the doctor is saying, kind of watching what he's doing, but listening to what he's saying. And you're gonna know where in the software to type and put all this stuff. That's gonna be administration. All of y'all fall under the line of healthcare administrators, medical billing, hospital schedulers, front desk, back office, medical records clerk, documentation specialist. All y'all fall under that category. Y'all administrators, you all do not do any clinical work. Stay in your lane. You don't have coordinators. What is it, baby? Care coordinators. Care coordinators. Okay. Stay in your lane. If there needs to be a diagnosis code change, what did I tell my class to do? You take that to who? Who changed those codes? It better not be you. No. The doctor changed those codes, or the nurse changed those codes. Okay. All you're trying to do is edit and make sure, hey, I need you to double check this. Is this correct? You know, because I'm finding that this should be this. If they're going to change a code or adjust a code, they have to do that. Why should they do that? It's because anything that gets changed in the system, there's an IP address that has their login, their password to say that they're the ones that did that change. They have that authenticity to say that's connected to that person. Okay? All right. Let's look at this. Let's look at options. Options, show flow sheet, show encounter flow sheet, show E&M analysis. E&M is evaluation and management analysis. Okay, forms, show data tree, shift data tree, flow shift from page, narrate, show references. Next one is summary. Okay, graphs, current findings, body mass index, head circumference, height, weight, length. Okay, all that is on there. Now, the reason why they have that listed under graph, because some of y'all may work in a pediatrician office, and have you noticed, for those that have children, when you go to the pediatrician, they will tell you where your growth, your child is in the growth chart, right? Compared to other peers their age, right? Okay, and probably their weight. They're going to say, well, they're in this range. Okay, they should be right along with this, or they're a little bit over that. Okay, that's where the graphing comes in. It's really important that they have that. Body mass index, they should tell you, person, your height, your age should be a certain weight. Okay, and they will do pie charts or different column charts for those kind of things. That's why those things are there. Remember, I told you that when it comes to graphing and things of that nature like this, the height, sometimes the diagnosis and the procedures, all that plays a role in statistics. Okay, that plays a vital role on how the ICD-10 is updated. That plays a vital role on how the CPT book is updated. Okay, all right, let's go to the next line here. You have exit. Okay, so everybody click on exit, see what happens. Is everybody, oh, I see it. Everybody off the screen? Mm-hmm. All right, very good. Very good. Now, make sure that everything that you do before you exit off the screen is saved on the screen. Some of your softwares have the, what do you call that, the automatic save information, but make sure that everything is automatically saved. Okay, let's type in our information again. Okay. Browse. Click at browse. Okay. Medicine search. Search is going to help you search out other diagnosis codes. Okay. Now let's go here. Let's look at this. See all these plus signs right here? As my mouse is going down the line here. That's letting you know all of this, the encounter background information, the systemic symptoms, the head-related symptoms, neck symptoms, eye symptoms, all that is broken down according to systems and body parts, okay? Now, these are like your main terms of where diseases are. Anytime you see a plus sign in front of it, that means it has another branch, okay? Let's click on the first one. Enter background information. So let's click on that one. Okay. And now it changes to a minus sign. Do y'all see that? Okay, so it changes to a minus sign. Now, do you see the red, like the red circle here? It looks like a circle to me. Y'all see that what my mouse is? Okay. You're going to notice throughout the exercise that sometimes it's going to tell you to go in and change information, and that information is going to change from red to blue. When it changes to blue, that means it's good. It's in the system. You did it correct. If it's still red, that means you need to fix it. Now, let me give this beautiful disclaimer of how medicine works. Okay. I know some of y'all might get a little frustrated with medicine. I know this. Okay. Some folks I've had over time where they like doing electronic health records and they go right through just fine. Some folks like SEMO a little better and they go right through just fine. Some folks don't like one versus the other. Now, it's the truth. I'm sorry. Okay. However, you're going to find this software to be a little tedious on purpose. Why would it be a little tedious on purpose? Because it's going to make you pay attention to detail. Okay? That means if you put in an answer and the answer, let me write on the board how that may look. Okay. Did everybody see? If the line is right here, you're going to, the box, here's the box. And you're going to write the answer. And you may write the answer, type it in. Okay. Do a little squeak. You may type in your answer right here. And once you complete it, it's going to tell you, something ain't right. You need to go back and fix it. Okay? But I know the answer. That is the answer. Okay? Now, you're going to have to do a little manipulation. Instead of writing it right here, you might have to type it over and bring it a little bit back over to the margin and retype it. Now, once you hit the go key, then it's going to say, took it. And you're going to be like, how is that? When I wrote it like that the first time in, I scooted over, and then all of a sudden I took it. It's just that tedious, okay? But it's not like that in the real world. It's not all the time. I'm not going to say 100%, but it's not like that all the time. It's to make y'all pay attention to what you're doing in the classroom. I'd rather for you to be frustrated and scratching your head and don't throw tomatoes at me. Just throw paper in the air somewhere. And get it in here. So when you get out there, you feel secure. It's not you. I guarantee you, some of your coworkers are going to say, it's not you, it's the software. Okay? So I want you to feel secure in that. So it's going to work you a little bit. It's going to work you a little bit. But it's to make you think and pay attention. All right. Now, let's look at some of these other little branches over here. Now, we have phone call and we have chief complaint. We don't see any plus signs on there because there are no more branches in front of plus signs or any more branches. It is what it is. Okay, so you're going to put the phone call in there. You're going to enter that information, chief concern for patient calls, or the chief complaint, the CC. Let's click on this plus sign and see what else comes up. Okay, so visit for, is it for examination, radiotherapy, is it for chemotherapy, laboratory, those kind of things. So now we see 4 plus signs that are designated in certain areas. Let's look up examination. So let's click the plus sign over there. Okay, very good. Is it general multi-system exam? That's like your physical. Prenatal, postpartum, that's after having a baby. Routine neonatal observation. Okay, so all that falls in line. Health supervision of infant and child. Adoption, daycare, preschool. Okay, let's look at general multi-system exam. Let's click on that plus sign. Okay, so now it has like a few more branches coming out. That branch is just branched out. It is through going. It's not going to grow any more branches. Can y'all see that? Routine adult health and physical. Comprehensive medical evaluation. Okay? So you're probably saying, well, Ms. Harper, why are we going through all these trees and branches? Okay, I'm glad you asked, because your instructions, this book is going to tell you, once you all get your book, and I'm going to double check because, well, Dr. Betty has already said we're going to need an access code. So we're going to utilize the temporary access code, okay? The reason why is because you may want to do some of this at home, you know, practice doing some of this at home. Now, this is the book you need. When you all get ready to do the assignment, it's going to walk you through step by step, real easy. All me and Dr. Betty are going to do is emphasize real world application. Okay, practicums, real world practicums to what goes on in the real world. This right here is real world. This is theory. We're going to teach you theory and you're going to do the practice. Okay? All right. Let's move on. Okay, so let's look at our package that we have here. Okay. And history of electronic health record, blah, blah, blah. Patient support, blah, blah, blah. Health safety, blah, blah, blah. Office of National Coordinator for Health Information Technology, blah, blah, blah. Yeah, that's what I like to say. Goal 1, advanced person-centered and self-managed pay, blah, blah, blah. And if it's not in this package, which it should be, then I'll probably read it to you all. Okay, tutorial exercise. Overview of patient account. Go to page 27. Okay. Page 27 has tutorial exercise 1A. Does everybody see that 1A? Okay, so you're going to see every exercise is going to be like 1A, 1B, 1C, 1D. So you want to let me know. Once we give y'all the registration forms, then the registration forms, I'll be able to go in once y'all register under my class name. I'll go in and see how you're progressing, how you're doing. Okay? Now, and then the same for Dr. Smith for her class. Okay, now let's look at the first one. Here are some terms used in a tutorial with which you may not be familiar. Patient account, guarantor, health plan or payer, policy number or member number, group number, policy holder, beneficiary. Let's turn the page over. Assignment of benefits. Okay. All right. Now, let's look at case study number 1. John and Shirley Colby are bringing their new baby, John Jr., for his first visit to the pediatrician. Before being seen by the doctor, the new patient must be added to the system. The parents have completed the paper form shown in figure 1-11. So step 1, you would need to access the internet for this exercise, blah, blah, blah. Okay, step 2, locate and click on exercise 1A. So now, we're going to have to go in and create an account. So everybody, let's X off of this. Let's X off of this. Let it go. And we're going to go, let's use Firefox. Just in case, we may need that extra whatever Firefox offers to open up the data so we don't have any problems. Some things may open up better than it does on Chrome. It opens up better on Firefox.
It's asking for our email. Put our email in.
Firefox?
We usually use the browser.
So just skip it. Yeah.
Okay.
Mm-hmm. Okay. All right. We're going to go in and create an account. Okay. So let's go up here. My Pearson Lab. .com. MyPearsonLab.com. MyPearsonLab.com. Pearson is Pearson, lab.com. You should come up with the same screen that I have. Let me know if you have problems. You didn't get it, sweetie?
No, I got it.
Okay. Cindy? Karen? Dana? Ileana? Okay. Allison? Dr. Sunshine, are you in?
I try again, the connection was reset, reset.
Okay, hold on. Go on the web browser. No, go on the web browser. Yeah, go to the web browser. Up. Click. Pearson Lab. .com. How y'all doing over here? Huh?
We're watching.
I have not put them under the class yet.
Oh, okay. I'm just gonna get them to register, and then they can go back in and do. Okay, I got it.
Okay, well, go ahead. Go and register.
Okay. All right. Now click on here where it says student. Register. See what it says student?
Yep.
Okay. Click on student.
You may have.
Okay. Click on don't show blah blah blah. Okay. X out. Yeah.
Oh, it says student, and it says get registered in that box.
Hold on.
What you trying to do?
Okay, get registered. Okay, so you will need three things: your email address, your instructor's course, and access code. Okay, so at the bottom where it says "Okay, register now." Okay, click on the X.
Right here.
See what it says? Don't answer this again. And then,
Right.
yeah. Right. Did you click? Okay, click on that X. Okay, yeah.
Yeah.
Mhm. Okay, now click on student. Okay. And it's telling you what three things you need. Okay, register now. Okay. Everybody click on there. Okay, so I'm about to print up my course ID. You want to print up yours, or you want to use mine, or you just want to use yours for your student? Okay. So you want them all under mine? You can. We use the same access.
Yeah.
Okay. All right. You're welcome.
I'm gonna let you all go under there.
Okay. Just put this in. Oh, maybe I didn't do it in Firefox. Okay. All right. So let's see here. Get registration instructions. Okay. So I'm gonna print. And I'm gonna do about 20 instead of doing like 18 minutes. Okay. So give me just a minute.
So they can just send the phone number. Because usually every time I have to give it.
Oh. You're passing out for me, Sarah? Okay, thank you. Okay. That's a cute dress. I like it. Okay. So put in the student, class code. Let me see it. Does everybody see the class code number?
Yeah.
Okay, Harper 45074. Okay, now it's telling you to press continue. Okay, very good, young lady. What's your name?
Jasmine.
Jasmine. Okay, very good. Stay right there. Okay. All right, now, wait. Okay. So you want to hit create after you do this. Okay, filling out that information. That's it. Yeah. Okay, everybody got it? Well, y'all in the process. Oh, okay. So, okay, so get temporary right there. Are you? Yeah. It's gonna tell you, it should tell you expiration date for your temporary code. Go to the bottom, temporary. Yes. Yes. At the bottom, baby, what's this temporary? Hey, keep going. Down. Let go. Yes. Yes. Okay. And then it's gonna say, go to my course. You're gonna click in there, go to my course. Mhm. Now, I should give you an expiration date, how long that lasts. It's good, how much? 14 days. 14 days? Okay. Okay. Put it in again. Yeah, there you go. Okay. No. See, the year of work, that's it. See, now you gotta check. Which means it's right. You course, you know, push it back. December 20th, okay. No, that's when I put that in there. You say you registered in Pearson before? For another class, but it wasn't the EHR book, right? Okay. Yes. Oh, okay, then it opens it right up.
Yeah, once it loads, yeah, see now it's, we have the temporary.
Do you have another email
It's
address?
online for 14 days.
Okay. I tell you what. Give me a pen. What's your email? R-E, R-A? $80.17. You have a middle name? Hold on. Go back here. No. No. First, yeah. Okay. Yeah. That's okay. Go ahead, A Harper. And you registered everything. Oh. Okay, go back to your home page. Okay, go to your. Go up here. Still got all of it. Okay, sign out. Yeah, click out of it. Yeah. Okay, now go back and verify. And not now. Now go up here and put it in my person. There. Click on student. Click on OK. And put that in, put it in professor.
put in a username. Still doesn't give me that great option. Long pass. Go back. Different. Because it's got USA lock. Okay, so it's on here. It's and then it's on here. Okay, go back up here. Mhm. Student, register. Okay, and choose that. Just create. Okay, use a different email address. Use this one. I don't know what it was on the back. Like, it's
But
not.
it's taking, some kids are, they're taking.
Okay, we'll go and create one right here. Open up. Okay, so make up the email address, then write it out. Okay. Yeah, you just need to make another email address. Come on, Pop, close up, bro. I know. Okay. Should be on the screen. Hold on. Okay. All right. Now, everybody should be on this screen. So touch the blue part of this box. Everybody should touch the blue part of this box. So click on the blue part of the box. Okay. Now, this is where I'm able to go in and see all of your stuff. However, you have exercise 1A, 1B, 2A, 2B, 2C. Okay? So now we're going to choose an exercise. So choose an exercise. Yours should be different from my screen. Let me see.
Yeah.
Yeah, yours is different from mine. Yeah.
But we have only.
Yes. Yes. So go right where
where it says exercise 1A. Click on exercise 1A. Okay. Click on exercise one more time. What is that box saying? Yeah, click on 1A again. Okay, pop up. Okay, see at the top where that yellow strip is on the top of your page. Go to options. 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 Allow pop-ups. Now it's bringing up your assignment. Okay, now it says, are you ready to start? Hold on. It has 2 questions. These are like quizzes. So you're going to utilize your packet to answer those questions. So let's click on the green button. Yes, start test. Okay. So it's telling you to click the what is that word? I can't see. Click the following link to view the video. So you're going to click on that blue link to view the video. Okay. All right. So that's the video of the electronic health record. Still reading. What does it say this? Oh. Okay, we're going to learn how to. Okay, excited. Okay. Did yours come up? Okay, yours, Gabriel came up. Let's find this thing. Yours thing first. Oh, and the yours thing. Okay. Oh, he's on Google Chrome. April. What did you say? Oh, he said it wasn't loaded. It wasn't loaded from on Firefox.
Yeah.
Oh, so maybe we need to. Okay, so let's switch over to Google Chrome, you guys. My bad. My bad. Yeah, I see mine is still thinking it feels like that too. Okay, so go to Google Chrome Thanks, Gabriel. Yeah. And then just log in as normal under Crown. When you go to your web, when you go to the web page. Huh? Yeah. Go in the web browser and put in PearsonLabs.com. Yeah, mine is still going up here too. Yeah, once you go into Google, you're normal. You don't have to register all over again. Everybody doing that? Is everybody on Google Chrome? Who's not on Google Chrome? How's it going, Dr. Betty?
It's going. We might need to put this on overhead because from the looks of it, the big overall picture is the video. And then everybody can see it at one time. We see it. Oh,
on the commercial stuff.
yeah.
Oh, you did the one that said not secure. Oh, there it is, okay. No, I thought you did. Oh, because we thought you did.
You may enter new patient update information for existing patients, and merge patient accounts. Let's put in the new patient account. From the point of care launcher, we will select the patient.
But right now, pause yours and let's look at this
First
one
step
all
in putting
together.
in a new patient account is actually to search the system to be sure that this patient isn't already in the database. To do this, we will select the ellipsis button beside the last field to start our search. On the Find Patient screen, we'll put in our search criteria and select the Find Now button. Here, we can see a listing of all patients currently in the database that meet the criteria entered. If we're trying to add patient John T. Colby Jr., we can see that he's not already in our system. So now we can put him in as a new patient. To do this, we'll select the New button to the right of our screen. That will bring us back to our patient administration screen, but with a few changes this time. All of our tabs are open. All of our input fields are open for this new patient. Also, the number field is automatically populated with a new patient number for this patient. Next, we'll begin keying in demographic information for the patient, starting with the Social Security number. You may notice that the Social Security number field is bold. Any bolded field is to indicate the information in that field is mandatory and must be entered before the patient information can be saved. It's also important to note here that you will only enter numbers, not dashes or slashes. This will apply for social security numbers, birth dates, and phone numbers. The system will auto-format the data for us. The chart number field is not used in these exercises because this medical practice uses electronic health records. The chart number field is used in practices that have paper charts. The system allows a patient to have multiple chart numbers because a practice may have had charts at more than one location. The chart number field is not required. Next, we'll put in the name of our patient. The prefix field allows the practice to add a prefix to the patient's name, such as Mr., Mrs., or Dr. The prefix field is not required and is not used at this medical practice. So we'll begin with the first field. Here, we will key in the patient's first name. The middle field provides a place to key in a patient's middle name, middle initial, or nothing at all. This is not a bold field, so it will depend on the patient and practice policy. We will enter a T here for our patient. In the last field, we'll key in the patient's last name. Suffix is used when a patient is a junior, senior, second, third, fourth, or fifth. Using a separate field for the suffix rather than including the suffix in the last name field maintains the correct alphabetic order of surnames and makes it easier to find the patient later. We will select junior for our patient. The nickname field is used when a patient prefers to be called by something other than their legal name. For example, Peggy instead of Margaret. The nickname displays on the clinical console and e-superbill. It can be used in correspondence with the patient. However, you cannot use a nickname to retrieve a patient in the Find Patient dialog box. Next, we'll enter the patient's birthday, which is required. When we select the next field, which is gender, we'll see that the patient's age is automatically calculated for us. The gender field is also required, and the user must choose male or female. Next is the patient address information. On the first line, we'll key in the street address for our patient. The line 2 field in the address section is used for situations where you need a second address line. None of our patients have a 2-line address, so we'll move on to enter the city, state, and zip information. If the city, state, and zip you're entering have been entered before, and the values are stored in the database, we can skip entering the city and state, as these fields will automatically populate when we enter the zip code in the zip field. The patient status field statuses can be assigned to a patient recording indicating certain important information about the patient. There are two types, patient status and account status. Patients can have multiple statuses of either type. Next, we'll enter our home phone number. As you can tell from the fact that this field isn't bolded, it's not required. However, it is always strongly encouraged, and in our exercises, patients should always have a phone number. You may also enter a work or cell phone number here as well. The doctor of record field is the next required field. This field indicates a patient's primary physician at the clinic. For an initial visit, this will simply be the doctor they are scheduled to see that day. To select the doctor of record, we'll click on the ellipsis button beside the doctor of record field. On the patient record security screen, click Add to see a list of all possible doctors of record. Let's say our patient's going to see Dr. Jordan for this visit. So from the drop-down, we'll select Laura J. Jordan. Once we've selected our doctor of record, clicking in any of the other fields in the row will populate the other fields here. We can use drop-down menus here to change this information if necessary. For example, if our doctor worked out of more than one clinic, we can select from those clinics in the drop-down menu in the location column. Also, if this doctor is associated to more than one financial group, we can make the change using the drop-down menu in the financial group column. When all information is complete, click OK. The privacy consent button will be addressed at the end of the overview. We'll return here to complete this as the final step of setting up our new patient. The portal setup button is used to set a patient up for portal access. The final step in the patient tab of the demographics tab is to choose a relationship from the patient's relationship with the guarantor drop-down. The guarantor is the individual who will be financially responsible for this patient. The rest of the information on the screen will deal with the guarantor. To begin completing this information, you will click on the arrow in the field beside the patient's relationship to guarantor. Here, there are four choices: child, other, self, or spouse. We will choose child, as the patient is the child of the guarantor. Selecting any of these options will pull up our Find Guarantor screen. This is to help ensure you do not create a duplicate guarantor. We can enter any search criteria in addition to the criteria populated here. And click on
I have done already. Who's playing it?
the guarantor we are looking for. We can select them from the found guarantors field by clicking on it. Choose him by selecting the row with his name and clicking the OK button. And choose from the drop-down menu provided. In this case, we'll choose English. The mother's maiden name field is an optional field to collect information about the patient from this tab as we demonstrated in Chapter 1. We don't currently have any documents to scan here, but we can come back and add them if necessary in the future. The employer field is available. To do this, we'll select the race button. This will open the patient race dialog. We can see in this dialog that a grid on the left holds some race categories that are approved for UDS reporting. If your clinic is involved in this type of reporting, you'll be informed of this, and you should choose races from this column. To do so, click on the green plus sign in the select column race we wish to choose. Once chosen, the race selected races grid at the bottom of the dialog. If the race we're looking in the UDS approved races grid, click on the down arrow in the additional races field. Select a race from the drop-down menu. After selecting this race, we'll click on the Select this additional race button to move the race we chose to the selected races grid. We can also search for the race we are looking for by clicking on the ellipsis button beside the additional races field. This will open the Find Additional Races dialog and allow us to enter our search criteria in the name field. When the race is found, return to the number of additional races found grid, we can select the race we're searching for. Any of these methods for selection will be completed by selecting the OK button at the top of the patient race dialog, which will return us to the Additional Patient Data tab with our selection populating the race field. The ethnicity field is used to document the patient's ethnic status. To choose an ethnic status, we'll click on the down arrow in the ethnicity and select one of these statuses by clicking on it. The veteran field is where we can document if the patient is a military veteran. This is a drop-down menu that is accessed by clicking on the down arrow in the veteran and choosing from the drop-down menu. The cancer CDA frame holds several fields that are used for meaningful use data reporting. Industry and occupation are reporting what area. As our patient is a newborn, we don't have any information for these fields. So we'll move ahead. Within the place of, we want to enter the city.
Okay.
We're
Or maybe
gonna
choose
stop
from the
it right
drop-down
here,
menu.
Dr. Smith, because we'll come back here. You all have your own access
Or by
to,
using the ellipsis search dialog.
you all have your own access to view this at home. You can view this on Fridays. Sometimes if you wait till midnight, they're trying to work on the website, so kind of give them I already designated certain days. From today's date to November 5th, we're going to be doing electronic health record system. Then November 6th to November 20th. We'll be doing computers in the medical